Hi, everybody. I'm Leslie Eckford.
And I'm Amanda Lambert, and we're with Mindful Aging, and we are co-authors of Aging with Care, Your Guide to Hiring and Managing Caregivers at Home. We are super excited today, very excited to have a special guest, Monica Bell, who is a nurse practitioner who specializes in bioidentical hormone replacement. And we are going to talk about so many important and fantastic things, including sex,
Always.
muscle strength. We're going to talk about bone density. So I'm just going to turn it over to Monica and we're going to have a little conversation.
Well, thank you, Leslie and Amanda, for having me. I'm a huge fan, and so it's an honor to be here. But my name is Monica Bell, nurse practitioner. I specialize in hormone therapy with the goal to improve quality of life and vitality through the lifespan.
Great. Well, one of the things I've been reading a lot about, Monica, is muscle mass. As we get older, we seem to lose a lot of muscle mass, and that it's important to maintain muscle mass for function, for flexibility. So tell us about how hormone replacement therapy can help.
Well, yeah, and just what you mentioned, muscle mass starts to decline as early in our 30s.
Oh,
I know,
wow.
it's terrifying, and it declines. We have a big drop off right around menopause for women, and then after 80, it's a really dramatic drop in muscle mass in our bodies. So
That's pretty
even if
scary.
we're active, we can have a decrease in muscle mass. So
That's what I was going to ask, because I know for women, the fitness industry has been marketing to us and encouraging us to come in and pick up those weights, and that's going to solve the problem. We're going to be able to build that muscle mass back. But it's really, I kind of look at my bicep and I'm like, that doesn't look all that different yet. So what is that relationship there?
Right. Well, this is a common story I hear from many of my patients. They'll say, I'm going to the gym, I'm working out really hard, I'm doing everything my trainer tells me to do, I'm eating all the right things, but I still am not gaining muscle, I'm not getting stronger, and I feel weak. I don't feel like I'm getting stronger. So really not making the progress they want. And so as hormone therapy, what does that play in the role in? I always say hormones are essential building blocks for muscle. And so it's like we're trying to build a building without materials like cement and bricks and mortar. So we just don't have the essential building blocks, which hormones do.
So tell us how you determine what someone needs. So let's say a 65 or 70-year-old person comes into your clinic and you evidently test them, right, for their hormone
Right.
levels, and then what happens?
Yes, so we test hormone levels, and for most women, hormone levels are 0.
Zero.
Nowhere to go but up.
Right.
That's true.
Right?
It's really true. I always tell women, like, menopause is normal. It's natural. We just lose all of our hormones, testosterone, estrogen, and progesterone, DHEA as we age. But those are essential building blocks for muscle and bone.
Okay. And speaking of bone, a lot in the media about the number of fractures that older people are having. Bone density is a huge problem, and a lot of people are taking some of the traditional medications to increase bone density. So what's your view on that? What would be your approach to bone density?
Yeah, I see a lot of patients for improving bone density. It's one of my favorite reasons to do hormone therapy because I feel like it's a very reasonably safe, especially compared to the other medications that are being offered by primary care physicians to treat hormone therapy. And you need all the hormones to help build bones. Testosterone and progesterone help build the muscle, and then estrogen helps keep the bone from the destruction. What happens as we age is our bone eating, our old bone gets replaced, but it's waiting for new bone. So our body kind of is, if we're talking about construction and building bones, as we were with building muscle, it's like we have more people on the demolition crew than we have
Right.
on the building
Oh.
crew.
Uh-huh.
And
Okay.
so hormones adds to the building crew to build the bone instead of destroying the bone. They're taking the bad bone out.
So how long does it take to get this building crew, going?
Yeah, that is the building crew for the hormones takes at least a year.
To see like significant gains
Yes.
in muscle mass and in bone density?
Yep.
Okay.
Yes, it can take up to 2 years to get the max result from hormone therapy and bone density, and same with muscle. So I always tell patients to be patient. It will come, muscle strength and bone building will come, but it can just take a while.
Okay. Great. Very, very good.
Can you give us an example of someone who's come to see you who's had some good results?
Yes, I've had really great successes, and one of my favorite stories is this. I had a woman come to see me
About what age range are we talking?
around in 60s,
Mhm.
mid-60s,
Mhm.
who had osteoporosis. And her goal with hormone therapy was to, because she'd done some reading about hormone therapy being beneficial for bone density, and she didn't want to go on the traditional medicines that have pretty significant risk factors themselves. So we started her on some aggressive hormone therapy for bone building specifically. And so she had had osteoporosis when we started, in her hip especially, and in her back. And within 9 months, so she'd had a bone density a little sooner than I had anticipated checking, but by the end of just 9 months of hormone therapy, we'd increased her bone density in her hip by 4%.
Wow,
Yes.
that's huge.
It's
Fantastic.
huge. Yeah,
Fantastic.
That is
That's-
really amazing.
Wow.
That's what
And
makes
I
it
know
so fun.
people have questions about, what some of the risk factors may be. But what we would love to do, Monica, is talk with you again and fill in our listeners and viewers with more information, because Amanda and I are really dedicated to giving people information. This is your life, your aging. You are going to make it the best that you can be. And we're going to find out more.
Yes.
Thank you. I'd love to.
Thanks.
Thank you.
Thanks, everybody.
Stay tuned.